Assalamu alaikum and welcome to our health show. My name is Dr. Saira Dar and today we're talking about contraception. So the things we'll talk about is contraception permissible in Islam? Why is it important? And what are the methods available to us? I think to start off with, it's important to say that Allah SWT has made contraception permissible because the act of the sexual activity between husband and wife is not just for the purpose of having children. We're encouraged to find enjoyment with each other, solitude with each other, and joy in the act. So therefore there will be times where a couple doesn't want children, isn't prepared for children, and Allah SWT has made contraception permissible under certain guidelines. It's also very important that you discuss contraception with your partner so you're both on the same page and find the method that best suits your needs. Why is contraception important? First of all, it means that women can be in the best of health before pregnancy, and that means a healthy pregnancy and it means a healthy baby. Now we know women that take folic acid supplements before they become pregnant significantly decrease the risk of the baby having brain and spinal cord defects. It also means that we shorten the space in between pregnancies, because having very short spaces in between pregnancies can lead to a low birth rate and also preterm babies. So having a planned pregnancy allows for a woman to be in the best health before she falls pregnant. Number two, it decreases the risk of unplanned pregnancies and abortions. Now it's a fact that in our society this happens, in the Muslim community this is happening. And we need to deal with this, and prevention is better than the consequences of that. Abortions are a lot more common than we realise, and it can happen in very unfortunate and difficult circumstances, and women that would say that it would never happen to them, it's very possible. So prevention is better than the consequences of that. Number three, there are actually benefits to certain contraceptions out with preventing pregnancy. It can decrease certain cancers. It can also help women that have very heavy prolonged bleeding, endometriosis and painful periods. Unfortunately, in today's society, women are still deprived of the right to choose when and if to have children, and by doing that you're taking away their freedom, their autonomy and the right over what they do with their body. Having the right information and availability of good contraception allows women to be liberated and reclaim their sexuality and control over their bodies. So we have the information and we have availability of contraception, so it's very important to get yourself clued up on what's available and find out what suits you best. Now I'll talk you through the various methods that are available. One of the most common methods is the barrier method, things like condoms. Unfortunately they have quite a high rate of failure, which means that often they can lead to pregnancy, and I have seen that happen. Another method is called coitus interruptus, and that is a method that's traditionally used in Islamic history and before other methods of hormone contraception were available to us. Again, it has a very high failure rate and can often lead to pregnancies that are not wanted. There is the permanent form of contraception, which includes things like sterilisation and vasectomy. Now those have Islamic implications. Majority of scholars will say that that is not allowed because in theory it's irreversible and you're stopping pregnancy ever occurring, and that in Islam is not allowed. We do have many other methods that are quite long acting but reversible, and those include things like the JAG, which you get every 3 months, various forms of the coil, which can last from 3 to 5 years, and an implant. Okay, so let's talk about the implant. Now the implant is a plastic rod and it's very flexible, cannot be broken, and this is inserted just underneath your arm, underneath the sort of skin and the fatty tissue, and this lasts about 3 years, and it slowly releases hormone into your body which prevents pregnancy. And like I say, totally indestructible. It's a very flexible kind of plastic that's used. And then you have various forms of the coil, which sit inside the woman's womb. And I'll show you, this is the real size of one. And you get various forms. They last from 3 to 5 years. They're inserted inside the woman's womb. A very simple procedure, lasts about 10 to 15 minutes. Some of the coils have hormone around them, some of the coils don't have hormone around them, and again it depends on your medical history and your needs as to which one you would go for. The most commonly used one is the Mirena coil, which has hormone just on the band underneath. And again, the arms are quite flexible, so it slips inside your womb and then opens up and stays inside. And this string can be used just to check that the coil is in place. Another form of contraception, and probably the most commonly known one, is the pill. Now you get two kinds of pill. You get the combined pill, which has got 2 hormones in it, and that's the one that traditionally is taken for 3 weeks with 1 week off. And during that 1 week off, you normally have a menstrual period. However, evidence shows that we don't have to do that now, and some women use the pill to control their periods. So if they're going on holiday or Hajj, they can keep taking the tablets and they won't have any kind of a period in between. The other one is a mini pill, which has just got 1 hormone in it, and that is a pill that's taken every day without any breaks. And for majority of women, they find that they actually have no bleeding with that. So depending on your medical history, your weight, your blood pressure, your doctor or nurse will decide which one is best suited to your needs. I'd like to take this opportunity to mention the emergency contraception or the morning after pill. Now, if you're ever in that situation where you've had intercourse and you do not want to get pregnant and you're not taking any contraception, there is something called the emergency contraception or morning after pill available, and it's a tablet that can be taken usually up to 3 days after the act, in some cases up to 5 days after. The GP under these circumstances may actually advise you to get the copper coil. However, just please make note that this may have ethical, religious implications, because in some cases the copper coil prevents implantation of a fertilised egg. But the 2 tablets that are used for emergency contraception usually stop an ovulation or the egg being released from the ovary. So from an ethical and religious point of view, it may be a better option. And again, I'm mentioning this because if you're in a situation where this happens and pregnancy is not an option and you would even consider an abortion, this may be another option for you. I'd like to also mention about pregnancy testing. If your period is delayed or you think that you're pregnant, you don't need to wait a week or 2 weeks to get a doctor's appointment to get a test. You can just walk into your pharmacy, Boots, your local chemist, or even Home Bargains, and pregnancy tests are very, very cheap, a couple of pounds, and they're very, very reliable, and you can test them in the privacy of your own home to find out if you're pregnant. So please talk about contraception with your sisters, with your girlfriends, and if it's something that you need and you don't know enough about, speak to your doctor, speak to your nurse. The Sandiford Clinic in Glasgow have bases throughout Glasgow, and they're very good at giving advice about family planning. And you can even look them up online. They have a great website with lots of information. So share this information, talk about contraception, and thank you for listening to our talk on contraception. Assalamu alaikum.